Welcome to the session on digital health success and challenges in India. I think all of you know we are living in a world of digitalization, digital health. Wherever we go, we find even in the hospitals, various equipments have changed. Even simple thermometer, our BP apparatus, the monitors are there. All are computerized or digitalized. Very easy to now see that how patients are, the vitals are being recorded and they are being viewed. So before we see what are the success and challenges in the digital health, let us go through certain aspect. What is the background of digital health in India? As we know, the National Health Policy 2017 emphasized on universal health coverage, so that all the services are accessible, affordable. The basic primary health care is available to the people at their doorstep. And people do not face the financial hardship as a consequence of not able to afford the services. This is very important aspect. In the follow-up of National Health Policy, Ministry of Health and Family Welfare constituted a committee to develop a framework for National Health Stack. And this committee came out with a blueprint of National Digital Health Blueprint, which has laid down the foundation for building blocks and the action plan to implement digital health in India. What is the vision of National Digital Health Mission? That is, to create a national digital health ecosystem that support universal health coverage in an efficient, accessible, inclusive, affordable, timely and safe manner to provide wide range of data information and infrastructure services, provide open interoperable standard based on digital system and ensure the security, confidentiality, privacy of health related personal information. I think from the vision you can see the mission, and the vision is to provide quality affordable healthcare services, but the data and information provided by the patient, which is being maintained by the hospital, it is their duty to see that it is maintained securely, it is stored securely, and in case it has to be shared for the diagnosis or the treatment purposes, it is being taken informed consent from the patient to share it with the concerned doctor of the institution, and the security is maintained so that when it is being transferred, it is not gone in the wrong hand or it is being hacked. What is the objective of National Digital Health Mission? That is to strengthen the accessibility and equability of health services, including availing the continuum of care, and the ownership of data is with the patient, and the information and the technology which support this system is citizen-centric. Very important to understand this. Some of the current digital public infrastructure that was created in our country, very important: Aadhaar, which we need everywhere wherever we go, unified payment interface internet system, our apps are there, various mobile phones, which are actually our smart watches, which are the recent changes what we see in the digital world, and even every common citizen is using all these things. Then the government has put emphasis on ability to have digitally all the information available regarding all the health facility in all the systems of government and the private and voluntary sector. All the doctors, nurses, allied health personnel they are being registered on the portal. Then electronic signatures, paperless payment, security, stored digital records, then e-pharmacy and various other services which currently are available for the citizen of our country. Very important scheme under Ayushman Bharat is Pradhan Mantri Jan Arogya Yojana. PMJAY has successfully used available public digital infrastructure to provide end-to-end services through IT platform from identification of beneficiary to their admission, treatment, discharge and paperless payment to the hospital. You can see the life of the patient has become so easy. They will have an ID, they will get admission, treatment, everything is available online. Experience of PMJAY can be expanded to reach the digital health to all the residents as per their criteria and develop an open and the system which the health management can empower our people and the health system, because here patient is the owner of the data. They have the right to say whom you can share the data for my treatment and how much is to be shared. Even it is accessible to the patient also. Health data is critically creating holistic view of individual personalized treatment, improving communication between caregiver and the patient. What are the types of health data? Obviously, it is a personal health data and non-personal health data. Personal data is related to the individual, that is regarding to the background of the individual, medical history, family history and various other treatments and from which where all they have taken up the treatment. Non-personal health data means that includes health data like number of dengue cases, health and number of various cases as per ICD-10, cancer cases, your routine morbidity data, how many people, male, female, of which age group are being affected. This is non-personal data. How much equipment, supplies and drugs are available, which is not related to the patient directly. Healthcare providers create health data for the patient, for the institution, and most of these providers issue a physical copy of a health report to the patient as a part of treatment. Every patient has a right to get the reports of the treatment, investigations and the discharge slip. Very important to understand. Mostly, if you remember, in government hospitals, still the discharge slip is given in the two copies. One is the original patient copy and carbon copy for other purposes in case the patient receives. But the hospitals where they are computerized, they give the duplicate copy. Very important for the patient to keep that original copy with them so that whenever they go future for the treatment, now if it is digital copy is available, now there is no very less chances are there that patient may say, I have lost my discharge slip. I do not know what treatment doctor has given. So that is the biggest advantage in doing the records are being in the digital form. Then inpatient cases file the OT papers, operation theatre papers. They are not shared in routine, but in case patient needs for some purpose, the patient can request for that. Mission will require the healthcare providers to share a digital copy of the reports also. That is a long run mission that every hospital will provide all the digital copies to the patient so that they keep it as a record. Software system in healthcare, that is electronic medical record, medical health record and personal record. These are the three records. So electronic medical record refers to use within a hospital or a clinic to support patient diagnosis and treatment. They are actually being for the overall treatment of the patient from the beginning till end. Health electronic health record contains records for the patient across multiple doctors. That means if patient has gone to 5 hospitals, the consolidated treatment records will be available in the electronic health record. That is a difference. And patient health record means that is a personal record. Health ID. It is important to standardize the process of identification of an individual across healthcare providers. If every hospital give a separate health ID, it's very difficult to correlate the digital records. Therefore, a provision is being made to give a common health ID to the patient, so that wherever in India the patient will go, and the same ID will be used for the treatment. In case they have to access the digital records of the patient with the patient ID, that also can be accessed. So every patient who wishes to have their health ID records, they should create a health ID first. Each ID will be linked with the health data consent manager. Multiple health data consent managers are likely to be available for patient to choose from the options which are being given. Health ID be designated, not required in the physical form. It is digitally given. And health ID can be presented in a e-card format and issued to patient in case they need it. Like we have Aadhaar card. It is e-card is also there, hard copy is also there. So same way, health ID e-card will be available, but it will be in case they need, in grave emergency, the hard copy also can be given to the patients. Then public hospital, health centers and various hospitals will have the registry and help the individual to obtain the health ID. Patient can also have health ID. They can self-register themselves at the portal and through the mobile or the web application. And they have to give a basic information about themselves. Then the consent manager at the health facility will create their health ID. Possibly, there is a possibility in future, every health ID with the family members will also be linked with each other. Then the family health status can also be linked, so that there is any family issues, family problems, health issues like diabetes, heart problem, they can be taken care of. Linkages are important in cases where delegation, consent, organ donation, family medical history is required. This will actually help the health system. Health ID services will allow users to maintain a customized and delete and update the information also if they have the health ID. Then aim of the Ayushman Bharat digital mission is to develop the backbone necessary to support the integrated digital health infrastructure of the country. ABHA. This is the number which is actually be created under Ayushman Bharat to access the health records digitally. And lakhs of patients who are eligible for Ayushman Bharat has created a ABHA number. They have a ABHA account and health ID is there, which is helping the health system to correlate their health data, and they can access their services from anywhere in the country. Then health registry. National registries are the key building blocks of National Digital Health Mission. They are master data of all the entries in the ecosystem that includes our doctors, hospital, clinical labs, pharmacy, insurance companies. This provide all the information, all these registry of the health facilities. So nowadays all the facilities are being registered at the portal. Same way all the health personnel, I think all of you must have also registered with your respective councils, so that government knows how many nurses, how many doctors, how many allied health personnel are available in our country and where they are working and how many years are left even for their retirement, so that they can plan for the future manpower also. Then registry enables the hospitals to have a linkages with other hospitals to provide the treatment if they have to refer from one institution to the other, and patient has the access to all information about all the health facilities, about all the doctors from where they can avail these services. So health workforce registry is also very important. Then it's very easy to claim the health. Our claims, e-claims can be processed very easily under PMJAY, CGHS scheme, and various private sectors are there, and the health claim platform is there, and patient can easily put up their claims there, and the body which has to pay the payments like the government sector or from the whichever sector the person is working, the insurance sector payment is being done on behalf of the patient. Open telemedicine and e-pharmacy. As we know, during COVID, telemedicine has played a very important role. Patient who could not reach to the doctors all over the world, India, anywhere, patient can reach to the doctor and get the consultation and share their reports. And nowadays, even through e-pharmacy, patients can get the medicines, drugs, and with the prescription of the doctor at their doorstep also. So the digital health system is making the life easy for the patients. So you can see many market players are there in this system. So we have to see they provide actually the quality services also. That is a big challenge. Success and challenges. If you see during COVID, this app, I think all of us have used that for our COVID vaccination. The data which was available, and wherever we went, the certificate was easily available. Arogya Setu, to know about the cases nearby, how many cases of the active cases are there, and all the information regarding COVID. E-Sanjeevani, that is a platform by the government where the teleconsultation services are available, list of experts are available, their time is available, people can avail these OPD services. And E-Sanjeevani is two interfaces are there. E-Sanjeevani at Ayushman Bharat Health and Wellness Center, where staffs help the patient to get connected with the doctor, and patient and the staff is there and the doctor is connected. And the second is the digital health incentive scheme as a part of Ayushman Bharat. E-Sanjeevani National Telemedicine Services, it is available, portal is there, you can go to E-Sanjeevani, you can see how many thousands of patients, lakhs of patients, every day patients are connecting at E-Sanjeevani portal and getting consultation from best of the consultants all over the India. E-Sanjeevani Ayushman Bharat, already I have told you, it is in the Health and Wellness Center. It is known as hub and spoke model because patient goes at the hub where the CHO helps to connect to the consultant. And then your digital electronic medical records, telemedicine, mobile health, e-prescription, these are some of the important digital you can say facilities which are available for the patients. But there are certain benefits. As we know, doctors, good doctors, consultants, specialists are not available in rural and the tribal areas and in the remote areas. So telemedicine, telehealth has brought nearby the health services to the people. Today people can monitor their own health through various digital system, mobiles, various apps are there, smart watches are there. It's very easy now to check the blood pressure, thermometer, electronic thermometer is there. Otherwise, it was a big issue for our patients to check at home. They can actually monitor their own parameters at home also. And there is a big gap between urban and rural, and that has been reduced. And there are many electronic solutions are there which has streamlined the health services and become the cost effective also. Improve the healthcare providers' productivity. How? Previously, doctors were not able to see so many patients in the OPD. Now, after seeing the OPD, they can do consultation of various patients on the online platform, and they have to don't waste time on the traveling. So that time they spend on consultation with the patients. Then health management system, because now records are available digitally, even if it has to be transferred to the patient, the records, the investigation reports, even the your x-ray and ultrasounds, they can be transferred easily to get the best opinion from the specialists and the doctors, all not only in the India but even from the abroad. So, Indian digital health ecosystem offers healthcare startups the opportunity to scale up the services. Startups and established players collaborate to strengthen the system so that people can get the affordable health services. But there are various challenges also. Challenges is lack of infrastructure, your digital infrastructure, lack of devices, lack of people are not prepared to use the digital system. The training has to be given. Internet connectivity is an issue. So it is not easy. Sometimes the accuracy of the digital, if suppose someone is using a smartwatch or digital BP apparatus, maybe there may be a variation in the readings. So there are literacy of there is a digital divide. Maybe there are certain number of people still in the areas who are not well versed how to use the digital systems, how to go to the website or to use the mobile apps to access these services and to get their data or to monitor their own health services. Privacy concern, very important, the security of data, privacy of their information. When this AIMS data was hacked, people were worried. What about our data? If AIMS cannot have that security system, what about the small other hospitals which do not have so strong systems? So that is really a concern of the people about privacy and security of the data. Then lack of standardization of various systems through one hospital to other. Still there are problems that patients' data cannot be transferred digitally from one to another system because there is no one platform or one type of system used in by all the hospitals. Softwares are different and various other digital processes are different. So these are some of the challenges which are being faced by the system also, so that the patient get quality healthcare services. Then regulatory framework, still under process, but what are the regulations which will actually help to protect the data? No misuse of the data is being done. Uncertainty about the clear regulations, people still have that uncertainties. Data governance and compliance, lack of robust data governance system. That I think actually even normal people in the health sector also have, normal people population also have these type of doubts in their mind. Maybe over the time many regulations are under the pipeline, and security or privacy of the data, many things are going on. Maybe over the time these things will be taken care by the government, state and the central government. Then lack of skilled professional, cost and affordability. For digital system, cost is there. It's quite to build up a system, to maintain a system, train the professionals. Funding is necessary, budget is important. So in the providing cost effective care on one side due to digitalization and the other side to maintain the infrastructure, to strengthen the infrastructure, these are the challenges what our health system is facing. So these are some of the references you can go through. So in this session we have actually come to know about what are the digital platforms, digital interventions and digital processes which are in place for the patients, which are helping them to get the healthcare services affordable, cost effective at their own place. But there are certain challenges and the you can say, one hand, there are success factors which we have seen during the COVID, vaccination, your e-consultation, your e-pharmacies, which have rapidly come up during the COVID time. But after that, then again challenges of the training of staff, costing, governance, regulation, privacy of the data, security of the data. These are the issues which are being taken care of and are under the pipeline so that our people get affordable health care. PMJAY scheme is a successful scheme of the government where people as per their eligibility are having a ABHA account and health ID and have the independence and informed consent is taken before their data is being shared by any organization for any treatment. I hope the digital health system in our country will bring in revolution and provide healthcare services affordable to people, accessible and able to achieve the universal health access and SDGs by 2030 we are able to achieve. So that is a mission of the National Health Policy, National Health Mission and the National Digital Health Mission. Thank you.